pretty sure. So, since it is live, what I was doing is well, I was watching Reddit. Okay, I think it's recording. It's finally recording. So I was watching Reddit, and what I came across was, I was watching one of those Reddit YouTube things. Somebody was like mentioning how if you take too much ibuprofen, you won't feel anything. So I decided to, of course, watch a video by drugs.com to see what happens if you overdose on ibuprofen. If you can't see what happens when you overdose on ibuprofen. So let's find out.
Hello and welcome to VideoScript presented by Drugs. Today in the final of 3 presentations, we continue reviewing ibuprofen, a commonly used medication in the class of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. We will review important warnings and precautions with ibuprofen. It is important for patients to understand these warnings and precautions due to ibuprofen's widespread use and ease of availability as a non-prescription drug. Ibuprofen should not be used in patients who have experienced asthma or other allergic-type reactions after taking aspirin or other NSAIDs. In these patients, severe and possibly fatal allergies may occur with ibuprofen. The most common side effect with ibuprofen, like most NSAIDs, is stomach reactions like pain, heartburn, and nausea. To help lessen these side effects, it may be helpful to take ibuprofen with food or milk or at meal.
Wait. So side effect of ibuprofen is pain, but isn't ibuprofen a painkiller?
Time. Less frequently, serious stomach or intestinal ulceration, bleeding, or perforation can occur without warning. Patients older than 65 years of age or those who consume more than 3 alcoholic drinks per day may be especially prone to these serious stomach side effects. Patients who have a history of stomach or intestinal ulcers, bleeding, or other stomach disorders should consult with their healthcare provider prior to using ibuprofen. Patients who develop black tarry stools, severe stomach pain, or vomiting that looks like coffee grounds or with blood should immediately contact their healthcare provider, as this may indicate stomach bleeding. Ibuprofen, like other NSAIDs, may rarely cause serious cardiovascular side effects, such as heart attack or stroke. These risks may be higher in patients who have a history of heart disease or who may be at risk for heart disease. Patients who use heart or high blood pressure medications should talk to their healthcare provider prior to using ibuprofen, as it may worsen high blood pressure or cause fluid retention. There is no good evidence that taking aspirin will have a protective effect against these heart side effects due to NSAIDs, and taking an NSAID with aspirin may increase the risk of stomach ulceration. Patients who take aspirin as a blood thinner should check with their doctor before taking ibuprofen.
It's of course drugs.com, so I don't expect anything good.
Ibuprofen should not be used before or after certain heart surgeries called coronary artery bypass grafts, or CABG. If a patient should experience chest pain, shortness of breath, weakness, or slurring of speech while using ibuprofen, they should consult with their healthcare provider immediately. There are many other important warnings, drug interactions, and side effects with ibuprofen. Even though ibuprofen and other NSAIDs are available without a prescription, it is...
Yes, I'm hoping this is the video that we want to learn. It's by Miley, as you can see.
When you hear the word overdose, images of hard drugs or powerful prescription medications probably come to mind. And chances are you've never even thought about an ibuprofen overdose.
Sorry, just complete and total text to voice throws me off every time. By the way, I am sick. Am I thinking about overdosing on ibuprofen? No. I was just watching things on the internet because I'm sick. and saw that, people overdosed on ibuprofen and said they couldn't feel anything. I'm wondering if this can legit make you a god, like most drugs, suggest they can.
But it turns out that not only can you have too much of this relatively mild pain reliever, it can put your health in peril.
Oh.
As the most consumed over-the-counter pain-killing ingredient there is, ibuprofen is used by millions of people every day as a headache remedy to
What is the music? Hold on, that music is... No reference to music. It's obviously during Sandstorm, no doubt.
reduce fever symptoms for chronic bone and joint pains, muscle aches, PMS cramps, and so on. Ibuprofen is the active ingredient in many of the most popular painkillers available on the market today, including Advil, Motrin, Nubrin, and Rufen. In 2013, ibuprofen containing Advil reached sales volume of approximately $490.9 million in the U.S. Aloni, 1. Ibuprofen is a type of non-steroidal anti-inflammatory drug, NSAID. In other words, it helps reduce pain and swelling throughout the body because it's capable of lowering hormones that cause inflammation. All painkillers also interfere with normal functions of the nervous system, changing the ways that our nerves communicate feelings of pain when they occur in certain spots in the body. Taking ibuprofen can come in handy when you're injured, sick, or recovering from surgery, but unfortunately it's also overused by many people, potentially leading to multiple side effects and even poisoning. In some cases, someone might experience an ibuprofen overdose if he or she takes more than the recommended amount, but in other cases, it's not the dosage that's the problem, it's that the person has a medical condition that stops him or her from absorbing the drug's active ingredients normally. How an ibuprofen overdose can happen when it comes to taking any medication, whether a prescription or one that's available over the counter, you always want to take the smallest amount possible that will help relieve your symptoms. In other words, more isn't better, and taking high doses can cause side effects that are worse than the pain and swelling you were experiencing to begin with.
That's basic overdosing. What happens?
In the case of ibuprofen, overdoses happen when someone either takes too much at one time or the body doesn't metabolize and eliminate the drug properly. Ibuprofen works in the body by blocking prostaglandins, which are sometimes called local hormones because they have effects in certain parts of the body instead of the whole thing. One of their jobs is to cause inflammation in an attempt to heal us from illnesses or injuries. When it's needed, inflammation can be a good thing for helping us get better, but too much over a long period can do harm and cause ongoing diseases and pain. 3. Ibuprofen and other NSAIDs inhibit the synthesis of prostaglandins by blocking an enzyme called cyclooxygenase. This is a good thing for stopping pain and swelling, but can be problematic too, because it also stops normal functions.
Wait, oh. Okay, now I have to see this. I'm just following around.
I decided one day that I was just gonna try to kill myself because I couldn't handle it anymore.
It was one decision, one night, 1 year ago. Ross, who had been picked on for years and battled a medical condition, went to the bathroom, and while her family was sleeping, she took more than 100 sleep pills. That decision to take her life almost worked.
It's awful. There's no way to describe your child sitting there on life support.
But Hannah not only lived to tell her story,
I still think it was a pretty stupid decision of mine, and it wasn't worth it at all.
she wants to help other kids, other adults who feel as helpless as she did that October night.
I mean, it gets better, so you don't, even though it sucks at the time, it will get better, whether it takes a few days, months, or years, it will get better eventually.
Hannah missed her entire sophomore year at Ryle High School. It wasn't easy, but she faced her fears and went back. Only 12 weeks later,
I have a new job, so things are going good.
not only can she laugh again, she's on the honor roll, made the indoor color guard, and got her driver's license. Through therapy, family, and friends,
I didn't realize how many people actually cared.
she found hope and hopes others can too.
If you don't have anybody at home, you don't have any friends, maybe your teacher at school, or the random person you saw in the hallway. That could be someone who could potentially care about you.
Because of Hannah and other students who aren't afraid to talk about suicide anymore, change is happening at Ryle High School. In the classrooms, in the hallways, signs with a number to get help. And it appears students are.
And it says that you're not alone on it, and that have like pull tabs with the information on it, like everywhere. And some people are actually taking them. A lot of people are, because not everyone's not ashamed anymore.
1 year later, there's no looking back.
Okay, so that was a warming story. Okay, I'm legit just looking to see what happens truly when you overdose on ibuprofen. Okay, let's find an unexpected side effect of ibuprofen. Maybe this will help.
It's iPhone season, it's spring. The new iPhone 11 or iPhone 11 Pro with amazing all-new camera systems. And now you can get iPhone 11 for
$0 a month when you trade in your iPhone 7 or newer condition.
This episode of D News is brought to you by Domain.com. Ibuprofen. It's good for a headache, but can it help with social rejection? A new study says yes, it can, but only if you're a woman. Sorry, guys. Hey guys, Tara here for D News, and we've all taken ibuprofen, right? It's a pretty standard pain reliever, but a new study from the University of Texas at Austin says it can also affect our emotional status. And depending on your gender, that can be a good thing or a bad thing. This study involved 138.
I'm gonna ask this now. I'm 100% gonna ask this now. Whether you believe in two genders or not, I guarantee, like, okay. Let's actually read the comments. I want to see if it's there first. Are you, how high are you? No, officer. It's hi, how are you? There we go. Ibuprofen, sexist, there's one thing. Yeah, So who is RW? I go silent when I read, sorry. Oh, I know I'm now live. You don't need... Let me know. I know. Christ, what is this? So, no joke. With this, I'm surprised nobody's being like, oh, but there's more than 2 genders. Why didn't you cover them all? So,
Men and women,
yeah.
half of whom took 400 milligrams of ibuprofen, while the other half took a placebo. In the first part of the experiment, participants were instructed to play a virtual ball tossing game on a computer, but at some point during the game, they were intentionally socially excluded from the game. Afterwards, they were asked to rate how they felt about being excluded. Then, during the second part of the experiment, they were asked to write 2 detailed descriptions. The first being a situation where they experienced betrayal in a close relationship, and the second, a situation where they experienced physical pain. And once again, they were asked to rate their emotions afterwards. As it turns out, women who took ibuprofen were less hurt by being excluded from the game and by reliving a painful experience than men. And in fact, the men who took ibuprofen actually experienced a harsher reaction to rejection than men who only took a placebo. So in effect, ibuprofen makes women feel better about being rejected, while for men, it seems to do the opposite. Their feelings actually get more hurt. But how could this possibly be? I mean, we've all been conditioned to believe that emotional pain is totally separate from physical pain. But it turns out that may not be true. Recent studies have found that physical pain and emotional pain activate very similar regions in the brain. And in the man's brain specifically, evidence suggests that the part of their brain responsible for regulating emotions is also linked to the part that processes physical and social pain. According to the author of the study, Dr. Anita Evangelisti, if that is indeed true, then it's possible that taking physical pain relievers provides men with more cognitive resources to express the pain they feel. But what about women? Is there something specific in our brains that makes us feel differently? It's hard to say exactly what's at work here, but there have been other
this isn't, helping. So, we gotta go somewhere where we will find help. And that's my good old friend Google. Please tell me I wasn't looking up something fucking weird. I was just looking up a school. I was following an ARG. Search or type what? What happens when you overdose on ibuprofen? I'm so confused. Also, we have no cat toast. I know that nobody's watching. I know nobody watches my channel. But hey. Time it was swallowed, amount swallowed if the medicine was prescribed for the person. However, do not immediately. Ibuprofen is a type of ibuprofen overdose occurs when somebody accidentally or intentionally takes more than the normal or recommended amount of medicine. This is for information only. Do not use in the treatment or management of an actual overdose. Do not use to treat or manage an actual overdose. If you or someone are with overdoses, call your local emergency number or your local poison center. Can be reached directly by calling Recovery is likely with prompt medical treatment, except in the large overdoses, which some people may develop chronic liver or kidney injury. So, just always sold over-the-counter prescription. Yes. Eyes, ears, nose, throat, or mouth. Ringing in the ears, blurred vision. Diarrhea, heartburn, nausea, vomiting, stomach pain, stomach and low blood pressure, weaknesses. Kidneys, little to no urine production. Breathing, wheezing, incoherent, drowsiness, confusions, headache, unsteadiness. Skin, other. So this is what ibuprofen can do. Hold on. I have ibuprofen. Am I going to overdose? No, I'm not testing this. But 100%, I want to see what I have. Oh, it's legit just Kroger ibuprofen. Oh boy, I'm blacking out. Okay. So, Kroger ibuprofen. You can apparently overdose on it. So we know no benefits. You could basically go to a coma. You could just not even be understandable. You might breathe slow. All these horrible things. Now, hold on. What are the benefits of overdosing on ibuprofen? You know what? Let's do it. 420 channel. No, I don't want to do this. 420 channel. 420chan.org. I've never been to 420chan. I've only been to 4chan, but drugs. Other drugs discussion. My name is Anon. Hold on, I'm going to spell it right if I'm going to have to go to 420chan to find out what the benefits of overdosing on ibuprofen are. I can't believe I'm doing this. We gotta choose a file. Let's just take a nice little of Kroger ibuprofen. There we go. Okay. Submit post. View thread. How, if I'm not a druggie, you guys may ask, how the hell do I know a 420chan? Well, I know druggies for one, and also, I've been on 4chan. I mean, they know a 420chan. No matter where you're going, guarantee you might hear of it. If you go to the Pokemon thread, there's 420chan people on there. It's great. I guarantee somebody's just gonna be like, dude, just I guarantee nobody's gonna care, but hopefully I get some actual people who have tried overdosing on ibuprofen here. You know, let's return the board. Oh boy, I'm still the top thread. Why did I choose the thread where people are too high off their asses to do anything, to respond? What the heck? I'm so confused. The elements. No. Legit, no one is commenting. 4chan is such a big database, they respond immediately, but I don't expect 420chan people to be rational enough to respond. Please tell me there's still no one watching. Thank God. I need actual druggies to respond. That's why I didn't go to 4chan. I'm afraid the only real way to do this is to document what happened. I don't want to do this. I really don't. I'm just so damn curious. You know, curiosity is what killed the cat. But will it kill the human? I don't fucking know. God, I'm kind of scared. Kind of scared of what will happen. Any chance that it has ever been mentioned? The last post on this thread was posted on Monday. That was, that's been recently active. So it isn't the last post that's been posted, but it's the last post that was active. Because for some odd reason, I'm still top, and I don't expect these druggy people to respond. Why did I? What the fuck was I thinking? They're too high off their asses. Spawn out ibuprofen. I need actual druggies to respond because I guarantee someone's tried it. And I don't want to go down this rabbit hole of trying to overdose on drugs just to see what will happen. I at least want to see a post go above mine to know that I should leave. I want to respond on almost every thread. What about fucking ibuprofen? Oh, demonetized, but oh well. I legit just want to know. I just want to know, man. I want to know what happens if you overdose on ibuprofen. Nobody wants to overdose on ibuprofen unless there's a benefit, okay? Let me see the benefits. Drugs.com, well, we know that. Saw their video, man. Let's see news. See, well, the images maybe help. Nope, no, images aren't helping. How about oh no, by Advil. Videos better help. There's nothing. There's no benefits that are being showing up. I just want to know, man. there's no guarantee there'll be any benefit. Let's see if they actually listed a possible benefit, though. Cough and migraine. Okay, like ibuprofen Tylenol has no activity in the stomach and does not cause problems with stomach pain. No, it didn't help. Yeah, let's just do Healthline. Although they won't talk about why. You should. Don't forget ibuprofen. Increase your risk of having an overdose of ibuprofen. Okay, so we come to the conclusion from the internet that nobody's recording any benefit that has actual full things. Yeah, I mean, there was that one talk about in the description, but I don't know if that's accurate enough, you know? Is it accurate enough to say, yeah, like, would overdosing on ibuprofen really make you feel invincible? I can't come to the conclusion anywhere. That's just not someone's word. Just some random guy's word. There's no medical person that says you can do that. To be honest, I'm almost tempted to call an actual doctor. To legitimately ask that question. Oh boy. Oh, thanks. So, is it possible? No clue. Am I gonna find out? Probably not. Anyways, have a nice day, everyone.